President Obama thus far has refused to say that he and his family will be willing to receive their health care under the proposed government option. Instead, President Obama has openly said he wants the very best health care for his family. And I don't blame him. I agree with him. Ladies and gentlemen, I also want the very best health care for my family and me, and so do you. The recent Cash for Clunkers program quickly descended into chaos and confusion. Most of our car dealers are still waiting to receive money from the government. And we wonder how our government could possibly handle $2 trillion more in additional health care payments if our government cannot simply handle $2 billion in payments to our car dealers. President Obama recently openly admitted that our government is grossly inefficient. President Obama said, and I quote, "UPS and FedEx are doing just fine, right? It's the post office that's always having problems," end quote. We note that Medicare, Social Security, education, welfare are almost always having problems. Each is at the heart of political discussions and every federal election. As such, why would we want more of the same government-created problems? Our European and Canadian friends tell us that government-controlled health care is an evil nightmare that attempts to save money by rationing and denying care. The Honorable Daniel Hannan, a British member of the European Parliament, recently called the British National Health Service a, and I quote, 60-year mistake, end quote, and encouraged Americans to, quote, ponder our example and tremble, end quote. Mr. Hannan went on to warn us further, and I quote, "I find it incredible that a free people living in a country dedicated and founded in the cause of independence and freedom can seriously be thinking about adopting such a system in peacetime and massively expanding the role of the state when there's no need," end quote. Britain and Canada both pride themselves in having no death penalty for criminals. Yet each country passively executes dozens of its citizens each day by delaying or withholding medical care that we here in the United States presently expect as logical, routine, and expected. Both Democrats and Republicans want good health care for themselves and the family. That's not a partisan issue. We all want good health care. Many politicians are really not willing to sacrifice the health and happiness of their parents, their grandparents, and their families simply to allow the government to achieve more control over our lives. And that's why this health care situation is stuck. One party has control of the White House and the House and the Senate, but it can't pass the bills because too many people do not want to subject themselves and their families to this problem that's being proposed today. Ladies and gentlemen, if any of you really look forward to going through airport screening lines, or if you really greatly enjoy going down and getting your driver's license and dealing with the folks down there, then probably government health care might be appealing to you. Otherwise, I can't think of why it would be. The first section of our town hall meeting will consist of a series of questions for our panel members. The panelists will have up to 2 minutes to respond to each of my questions. The panelists will answer each question in succession as soon as our preceding panelist has completed their answer. The second half of this town hall meeting will consist of questions from you, our audience. So start jotting those down and get ready. And I hope a number of you have brought questions with you. To begin, the majority of our health care advances over the past 50 years have come from the United States of America. The United States of America has received more Nobel Prizes in medicine during that period of time than all of the other countries of the world combined. Almost twice as many people in the United States now claim to be in excellent or good health as compared to the responses obtained in recent polls from their counterparts in Canada and Great Britain. The first question, what do you value most in our current health care system? Dr. John Bessler will begin our panel discussion.
What I value the most in our healthcare system is that the patients have a freedom of choice of physicians and that we have prompt access to the physicians and to their recommended treatment.
I would certainly
Dr.
concur with Dr. Bessler on, the thing that I value the most is choice. And when you start looking at it, we as consumers demand the very best health care. We demand the very best physicians and surgeons. We demand the very best innovative technologies to diagnose the problem. We demand to have those services immediately. And so the thing that is of value that we all have to decide is that we have the choice and to make those choices. And we're fortunate to be able to demand those expectations, to demand those services. And to have the very best has never come cheap. So that then begs the question that we'll further get into tonight as to how do we handle the costs and how do we do things to provide better options and more options. But ultimately, the value is on choice.
Dr. Sealy?
Well, as a physician in this country, I and you enjoy the access to the finest technology and equipment any place. Simple fact. Simple fact. Now, in what country do you spend most of your time? Look at it this way. In Lubbock, Texas, a town of 250,000, and you can thank this gentleman over here for starting our medical school because that was almost alchemy, how they started this. And every man, woman, and child in this room enjoys a level of health care greater than you would have had this school not been here. I'm telling you the truth. Now, what about this town? 250,000. I can offer you service the same as you can get in New York City, San Francisco, or Houston. There's not very many countries with a town of 250,000 that can say that. That's a fact. Now, what about our warts? We have warts on the doctor's side, the hospital side, the insurance side, the government side, and the patient side. The U.S. is ranked 37 by the World Health Organization, and why? We spend $6,500 per capita, and those two factors are championed by the people that are saying we have the worst system in the world. But let me give you some facts, and Dr. Bessler started it. We are first in responsiveness. We are first in autonomy in making medical decisions, confidentiality, dignity. First in client orientation, including prompt attention to medical conditions, access to social service, quality of basic amenities, as well as choice of provider. We lose points because we lack universal coverage. That's true. But the factors that bring U.S. to number 37 are morbidity and mortality statistics. Understand what they mean. They're not health care statistics. But you wouldn't know that as lay public. In Japan, the life expectancy is 83. In the United States, it's 78. They don't eat chicken fried steak in Japan. And that's a fact. You are 12 times more likely to be shot in the United States of America and twice as likely to be killed by a drunk driver. Those two non-health care related statistics taken out of the equation brings the United States of America to number 1 on the World Health Care Organization. Don't ever forget it.
Mrs. Ashbrook.
We really didn't read off each other's papers. My response is very simple. It's excellence, absolute excellence. We have all the choices, all the access, which equals speed, as Dr. Bessler referred to. We have a level of expectation and care in this country that is beyond belief. We want absolutely the best, and we want it yesterday, and we don't want to pay for it. But we do have the preeminent care available in the world.